Okay, let's clarify. Migraines are not just bad headaches. If you ever had one, you know they can completely shut down your day. But what are they really? What causes them? And most importantly, what can you actually do about them? Today we're breaking all it down. What migraines are, the different types, the symptoms you should look out for, and the treatment options, from simple lifestyle habits to some exciting new therapies. A migraine is a neurological condition. That means it starts in the brain, not just in the head. During a migraine attack, nerve signals and brain chemicals get out of balance, and blood vessels in the brain change their normal behavior. That's why migraines often feel like a full-body storm, not just a pounding in your skull. Not all migraines look the same. Here are the main types. Migraine without aura. This is the most common kind. Intense headache, often one-sided, with nausea, sensitivity to light or sound. Migraine with aura. Some people get warning signs before the pain hits. This can be flashing light, zigzag patterns in vision, numbness, or even trouble speaking. That's the aura. Chronic migraine. If you're dealing with headaches more than 15 days a month and many of them are migraines, this is considered chronic. Vestibular migraine. This type mainly causes dizziness and balance problems, sometimes without the classic headache at all. And the tricky part, symptoms can vary not only between people, but even between attacks in the same person. So what does a migraine actually feel like? Symptoms can include moderate to severe head pain, usually one-sided, nausea or vomiting, sensitivity to light, sound, or even smells, visual disturbances like flashing lights or blind spots, dizziness or feeling disorientated, in some cases temporary speech problems or numbness. And migraines usually come in stages. Some people notice subtle changes hours before, like mood shifts, food cravings, or fatigue. Then comes the attack itself, which can last from a few hours to several days. And afterward, many people feel completely drained, like they're being hit by a truck. So what can you actually do when a migraine hits, or better yet, to prevent one from starting? Here's the good news. While there is no one-size-fits-all cure, there are a lot of ways to manage migraines. Medications. Doctors usually talk about two broad categories. Acute treatments. These are meant to stop a migraine once it starts. They can include over-the-counter pain relievers, prescription medicines that target the brain pain pathways, or anti-nausea medications. Preventive treatments. These are taken regularly to reduce how often migraines happen. They can include blood pressure medicines, anti-seizure drugs, antidepressants, or newer drugs, and let's talk about them a bit more. One of the most promising approaches right now is targeting something called CGRP, short for calcitonin gene-related peptide. CGRP is a tiny protein in the brain that gets released during a migraine attack, and it's a big driver for the pain and inflammation. These newer treatments either block CGRP itself or stop it from attaching to its receptors. In plain language, they cut the wires on one of the main migraine pain signals. For many people who haven't had luck with other treatments, CGRP blockers are a real game changer. Lifestyle changes. This sounds simple, but they make a big difference. Keeping a consistent sleep schedule, staying hydrated, eating regular balanced meals, exercising, and managing stress all help reduce attack. Many people also keep a migraine diary to track triggers, like certain foods, lacks of sleep, or changes in weather. Non-medication options. There are also devices and therapies designed to calm the brain's storm signals. One of the newer ones is rTMS, or repetitive transcranial magnetic stimulation. This uses magnetic pulses aimed at specific parts of the brain to reduce migraine attacks. It's non-invasive, and for some people it can be a really effective option, especially if medications don't work well or cause too many side effects. Other approaches include neurofeedback, relaxation training, and physical therapy if neck tension plays a role. So, migraines aren't just headaches. They are complex brain storms with very real physical symptoms. The key to managing them is finding your personal triggers and combining treatments that works for you. For some, it's about better sleep and stress management. For others, it's preventive medications or newer options like rTMS. If you deal with migraines, you're not alone. And with the right approach, you can definitely take back control. If this video was helpful, you can check the other one right here. Thanks for watching, and see you in the next one.